Hi, this is Jonathan Marks, and I'm here with Dr. Joel Nigg, PhD. He's the director of the Division of Psychology and a professor of psychiatry and behavioral neuroscience at Oregon Health and Science University. He will be speaking at the upcoming annual meeting of APSARD, the American Professional Society of ADHD and Related Disorders. That's happening this coming January 13th to 15th at the Mayflower Hotel in Washington, D.C. Dr. Nigg's presentation is about the environmental influence on ADHD. Dr. Nigg, can you give us an overview of what you'll be presenting?
Sure. Thank you, Jonathan. There's been a lot of assumptions over the last 20 years that ADHD is mostly all genetic. And this is ironic in a way because it's the opposite of the assumption before that, which was the assumption that it was all not genetic. And this new genetic or recently new genetic idea came largely from twin studies showing a higher association of ADHD between identical versus non-identical twins. However, what has happened there, we're going to talk about in this symposium, is a little bit too little emphasis on the environment. And there actually are strong scientific reasons being discovered now for why the environment is probably a lot more important than we've been thinking. And in a way, we've been neglecting it wrongly for the last several years. And so what I'm going to do in this particular talk is outline the scientific reasons why and justification for a renewed focus on the role of the environment in ADHD and the importance of the environment, and even what some of those environments probably are. And I'll do that by demonstrating how the heritability and environment go together and what those mechanisms might be. Then I'll get into the primary problem or issue that we all worry about when we try to study the environment in a disorder like ADHD that does have an important genetic role, is how do we sort out the causality of this? How do we tell whether the environmental piece, whether it's early perinatal problems or whether it's diet or whatever we think it is, how do we tell that isn't secretly a genetic effect? Because environments are influenced by genes. Obviously, we pick our environments, and parents with ADHD are going to transmit to their kids both some genes and particular environments that those parents will end up in because they have ADHD. So sorting that out requires particular experimental designs, and it can be done, but it requires the right approach. And so I'll address that conundrum and how we can get around it and sort this out, and then give some examples of studies that do that and that do demonstrate important environmental influences on ADHD. And so it's really putting that model forward, explaining it, and making sure that the audience here understands the importance of getting that reframe correct so that we correctly understand how ADHD works and do the right kind of science to figure out what causes it.
So, Dr. Nigg, let me ask a question. I've heard about animal studies that have been done that show that smoking or nicotine exposure can actually have multi-generational effects and possibly cause ADHD.
Yes, sure. And you mentioned the prenatal effects. So, yes, there's been a number of interesting areas in prenatal work. And intergenerational effects are a new area of investigation because of the realization that we can have what are called epigenetic changes, changes in the way genes are expressed that go into the germline and are inherited based on the experience of the mother or father prior to the conception of the child and prior to the birth. So that opens up a number of areas like smoking, like diet, like environmental contaminants during pregnancy. It can also have effects during the child's development after birth as well, although those effects obviously may or may not prove intergenerational for that child's offspring.
Right. And how big is the database or the data set on environmental influence right now? Are we just at the beginning of discovering this, or do we have a substantial list of studies that have already been completed?
What we have are a lot of studies that show that there are predictive risk factors, both before birth and during early life, that do predict later ADHD in the environment. What we don't have are a lot of studies that sort out which of those effects are really the environment causing it versus a hidden genetic effect that only looks like it might be the environment. And those newer studies that will control that are what we really need. We're fairly confident now, based on the studies that have been done already at a preliminary level, that some of those environments probably are not really causal, they're secretly genetic effects, and others really are probably causal. And that's what we need, another generation of studies now using newer methods to fully tease out, and that's what we'll be focusing on here.
Great. This is fascinating, and it's going to open up a whole new area of knowledge for both the doctors and the patients. So we've been talking with Dr. Joel Nigg. He's the Director of Division of Psychology at Oregon Health and Science University. He will be speaking again at the upcoming annual meeting of APSARD, and that's happening this January 13th to 15th at the Mayflower Hotel in Washington, D.C. We hope you'll join us. It's going to be a great meeting with a lot of wonderful presentations. Thanks for being with us, Dr. Nigg.
My pleasure. Thank you very much.